surgeon Dr. Mehmet Oz takes on the most critical health concerns of our times. Discover the future of medicine from those who are making it, and become a world expert on your own body on Second Opinion.
As many as 40% of Americans say they've tried an alternative therapy. And initial research shows that alternative medicine can work. Human touch has been linked to improved immune function. And back pain has been shown to improve with massage. And finally, migraine headaches, they can be controlled with acupuncture. Complex diseases require complex solutions. Alternative therapies can help make conventional therapies like chemotherapy more palatable. And sometimes they may even extend the lives of people who were never expected to live.
My name is Marissa Harris. There are 4 stages of cancer, and I have stage 4.
Modern medicine had given up on Marissa. She had surgery to remove a malignant lump in her groin, and further tests uncovered huge inoperable lymph nodes on her pancreas. But that wasn't the worst news.
My husband said, well, what does this mean in terms of Marissa's life? And he at first didn't want to say anything, and then he said, if she's lucky, maybe 9 months. I kept on saying, well, isn't there something I can do? Wouldn't diet make a difference? And, he said no. And I said, well, what about supplements? And he said no. And the last thing I wanted was chemotherapy. And I said, well, what about chemotherapy? And he said, well, maybe you should do that because it might give you a couple of extra months. And he said, well, don't you think it's worth it? And I said, no. I said, would you do it if you were me? And he said to me, probably not.
With traditional medicine giving her just 6 months to live, fate led Marissa to Mitch Gaynor, a conventional doctor.
I'm a medical oncologist, hematologist, and internist.
With a totally unconventional approach to disease.
Cancer can be a tremendous turning point in somebody's life in terms of really learning about the proper way to eat, the proper diet, looking at how you've held on to old stress and old trauma and old anguish. And being able to correct those causes is really the fundamental difference between integrative medicine and the way medicine is practiced is just dealing with the symptoms.
For the last 10 years, Dr. Gaynor has used ancient chants and sound to ease the fear and anxiety of his patients and lead them to a place of inner peace.
Peace is the most powerful force that any of us have to bring healing and transformation into our life.
And there is scientific proof to substantiate the bowl's effectiveness.
And the first bowl that I'm going to be using is a Tibetan bowl.
The singing Tibetan bowls produce a measurable wave pattern, which is equivalent to the alpha waves produced by the brain. They instill a sense of deep relaxation and inner space opening up.
Every culture on earth has used sound and music in their healing rituals for centuries, for thousands of years. So I don't find there to be any contradiction or any conflict between me teaching people music and voice and chanting and doing chemotherapy and bone marrow transplantations.
So I know that my interest in alternative medicine was partly sparked by the incurable cases, patients who I knew we had some solutions for, but I never thought I'd actually be able to save. And they showed me that they could use different approaches to find wellness in their lives. How did you get involved in alternative therapies?
Well, I've really found that through my patients that were using alternative therapies, whether they were doing yoga, whether they were seeing nutritionists, they were having far less side effects from the chemotherapy and were really doing much better overall.
Cancer numbers have become staggering. Today, 1 in every 3 Americans will hear the words, "You have cancer."
My name is Susie Ross. I'm 38 years old.
Last year, Susie became one of an estimated 15% of American women who develop breast cancer.
I had a modified radical mastectomy, and I had reconstruction at the time of surgery, and I had my first chemo treatment yesterday.
A longtime believer in holistic medicines, Susie found herself unwilling to risk her life on just one type of healing.
I mean, you are entering into one of the most frightening experiences of your life. Why would you ever want to see somebody who couldn't help you with the fear?
So you're a world-famous oncologist, and I can say that comfortably because I've taken care of patients that should have died that you kept alive. How do you make that jump, that risky career move, to start getting involved in these unconventional therapies?
I think that the major issue with me is being able to offer my patients everything that works. And I don't think that it's fair to make a patient choose between the best of conventional medical therapy and the best of what we call alternative or integrative medical therapy. The role of nutrition is critically important. And it's very important that we teach patients about things like green tea, like soy, like omega-3 fatty acids found in cold, deep water fish, then less common things that people may not know about, like mushrooms, maitake, shiitake, reishi mushrooms. These are things that have been used for centuries in other cultures, and which there really is a strong scientific literature for.
I didn't believe in any of this. But without doing chemotherapy, my cancer markers went from high to normal.
I want people to know that there isn't just one way. My way might not be the best way for everybody, but it certainly makes sense if most people are going to go to strictly conventional medicine. There's this whole other world that they're missing.
Everybody take a deep breath in.
Barring, getting married and having children, it's the best thing that could have happened to me.
It's now 5 years, and I wake up every morning saying, oh, thank you so much. I'm alive.
Dr. Gaynor has been integrating alternative and traditional medicines into his practice for 15 years. He joins me now. Welcome.
Thank you.
Both of us have pushed the envelope with alternative medicine. What will it take for other physicians to start exploring these therapies?
Well, I think it's a matter of really offering patients things that work, things that make every day better and more positive. And in the long run, we're going to see tremendous scientific data on the role of meditation, yoga, acupuncture, and nutrition in really fostering every body system that we have. There's a lot of data out there now, and there are a number of studies in progress, so the facts are undeniable. These techniques have profound effects, as do conventional techniques.
Mitch, what do we do for patients who have incurable diseases or ailments for which we don't have good therapies in conventional medicine? How far should they look? How far should they go out on a branch looking for alternative approaches?
Well, I found it very helpful to tell people you don't have to choose between conventional therapy and alternative therapy. That's the beauty of integrative medicine and integrative oncology in particular, that patients can begin to look each day at what they can do to make their lives better. We know study after study has shown how stress, depression, pessimism suppress every aspect of our immune systems. We know the role of stress in elevating stress hormones, which again depresses the immune system. And it's so easy to teach people techniques using music therapy, breathing, yoga, that have profound effects on all the body systems and can really teach people how to live each day is the most precious gift, and it's to take people out of that anguish that I think is at the root of what healing modalities are all about.
You say it's easy to teach people, and you actually do it every day in your practice. You take individuals who not only don't know how to do these different techniques, but they may not even believe in them. Show me how you teach meditation, for example. That's an area that I have a lot of problems.
That's something anybody can learn to do, where you start by doing some breathing in through your nose, out through your mouth, belly soft, so that with each in-breath, you imagine it as a waterfall of white light, belly expanding with each in-breath. And then you can really imagine certain little mantras. For instance, in Eastern cultures, it's taught that the creative aspect of the divine is female type energy. And so I teach people that you can just think to yourself as you're doing this breathing exercises, she changes everything she touches. And you do that while imagining that your whole past, your whole present, and your whole future is being healed by this energy which comes in through the breath. This energy is called in yoga prana, this life energy. In traditional Chinese medicine, it's called qi. And learning how to do this breathing correctly and use this creative life energy that comes in through the breath is amazingly simple to learn, but so powerful. And I've seen such amazing healing happen with it. And it can be used with the best that modern medicine has to offer.
Elegantly described. Thanks very much.
Thank you.
Can you play for us a little bit?
Yes.
I'm curious.